work that I've been doing over nearly 35 years has explored what I think of as the kind of experiential landscape of palliative care. That is, we're trying to understand the psychological, the existential, the spiritual dimensions of encountering a cancer illness, and how patients, how family members, how healthcare providers actually experience that dimension of cancer. At one point along the research path, realized that there were things that were even more ephemeral, if you will, but nevertheless really shaped experience for patients who were living with cancer. We began to look, for example, at the whole issue of dignity. Dignity-conserving palliative care is really an approach to palliation that makes sure that dignity and the preservation of dignity is kept within our focus as healthcare providers. And one of the interesting things that informs this approach is the realization that the disposition of the healthcare provider in terms of how he or she views or appreciates their patient, we found from empirical work, has this profound influence on patient experience. We've come up with an instrument called the Patient Dignity Inventory, which measures physical, psychological, existential, and spiritual dimensions of experience for people who are living with life-threatening and life-limiting conditions. One project that we developed quite a number of years ago is something called the Canadian Virtual Hospice, a resource that has become really the world's largest repository of information and support for patients, families, and healthcare providers. It is utilized by people around the world. The reality is that all human beings have some basic fundamental experiences that are at the core of what it means to be human, vulnerable, and ultimately mortal. To do good research, I think one needs to be creative and embrace the creative process. And I find that doing research has given me a place where I can be continuously curious.